Thank you very much, and thanks. As I think Mike and Maria and Dr. Tedros said, we're all a little sleep deprived and don't always hear the full question. So apologies if we miss a piece, and please do come back like that. So in terms of the challenges to joining the COVAX facility, this is brand new, and a lot of it is still under design. And the question was asked about resistance to joining. We're not twisting arms for people to join the facility. This is in the interests of countries to pool their risk, to reduce the risk of an individual country, and then be able to get the best possible prices and guarantee the receipt of this. Now, for many countries, though, remember, this requires legislation in some countries to be able to work with a facility like this. In other countries, they have to figure out, well, what are the actual costs going to be, and then what part of our balance sheet do we use, and how do we do that? Other countries have pursued bilateral deals, again, as you're aware, and you referred to those, and so they want to know how will we handle those within the facility. So a number of these details are still being worked out. I think the fantastic news is that no matter what the challenge, there are potential solutions to all of them. And what we've found, and credit here to the Director General who's led a lot of these conversations, when we hit the big challenges, and such as, of course, and I think you referred to it, the EU and other countries are setting up some bilateral deals, that the big issue is how do we make sure that those deals work in collaboration with the global COVAX facility so that we can roll this out to the entire world at the same time to cover their highest risk populations. So the key word here is how you join forces on that collaboration. And that's what I was referring to in the last intervention. We've had more and more discussions with a broader and broader group of players and tried to work through what might be the barriers to collaborating, and whether that are issues around price, issues around timing, issues around national expectations, etc. But this does take some time. Now, as much as we all want to have a vaccine tomorrow, we won't. It's going to take a little bit of time. And the key for us now is this is just one more of those windows of opportunity that we have to use extremely well to be able to optimize the use of the vaccines in scarce supply as they become available. And that speaks to the last point that was mentioned in Dr. Tedros' intervention about the global allocation framework. Again, this is a really important piece of work being led by WHO, working across all member states and other entities to try and agree together what our public health imperative is, what populations need to be vaccinated, in which order to be able to achieve those objectives, and then how do we translate that into a concrete mechanism to collaborate together on that rollout. It's the right thing to do, it's the fair thing to do, and I think, again, as the Director General said, you should speak to this, I keep quoting you, the evidence over the past and recent weeks is economically, this is in everyone's self-interest as well. And Mariangela has been leading a lot of this work and may wish to intervene as well.
Thank you, Bruce, and thank you for the question. I think this is an extremely important